She obtained her secondary education at Holy Child and Archbishop Porter Girls. She acquired a Bachelor of Science degree in biology at the University of Southern California in Los Angeles in the US. She attended the University of Wisconsin in Madison for a doctorate degree in medicine. She has had 5 years of training in surgery, trauma, burn, and 2 years of fellowship in burn and reconstructive surgery. She's also attended Johns Hopkins University in Baltimore and obtained a master's in public health in international health management and planning with special certification in humanitarian assistance and disaster management. She's worked in a private capacity in the US with licenses in California and Maryland. And in Ghana, she runs a private surgical facility here in Accra. I'm very pleased to also introduce a lawyer by profession, called to the Bar of England and Wales in 1988 and the Ghana Bar in 2008. He is a former Deputy Chief of Staff, a former Deputy Defense Minister, and also a former Health Minister. He's also currently the Director of International Relations of the National Democratic Party. He's also a member of the Inner Temple Inns of Court, and he's practiced law for close to 2 decades as a prosecutor. Distinguished guests, he's acted as a District Chief Prosecutor for South London District on numerous occasions, dealing with a budget of close to £100 million annually and overseeing a staff of 500. He's a higher court advocate dealing with cases in the Crown Courts, and he is the campaign coordinator. He was the campaign coordinator for the Mills Mahama campaign that ushered the NDC government into office in 2009. I think one of the things that's very important about him is that he was involved in key aspects of the Ebola crisis in his capacity as a Deputy Defense Minister and also as Minister of Health responsible for the construction of isolation centers in Tamale by the military with support from an NGO. He needs very little introduction. I present Honorable Alexander Segbefia. Please permit me to also introduce Dr. Prosper Akambong. He's a senior physician specialist at Tamale Teaching Hospital, a senior lecturer, School of Medicine and Health Sciences at UDS, a former director of medical services at Tamale Teaching Hospital, and former CEO of Tamale Teaching Hospital. He's also a former member of the National Emergency Management Team. We also have in our midst Mr. Nana Kofi Kwachi. He is an assistant professor in the Department of Health Policy and Management at New York University's School of Global Public Health, where he is also a doctoral candidate. He's a health economist and policy analyst specializing in healthcare systems and healthcare services research. He's had special focus on financing and providing payment mechanisms. I think it is important to note that in his capacity, he has represented legislative interests of 7 of the largest health insurers in the United States at the House of Representatives and Senate of the state of Georgia. Nana Kofi is also a political strategist with a specialization in campaign operations. He previously served as a national coordinator in the state operations and political engagement team for the 2016 presidential campaign of former Secretary of State Hillary Rodham Clinton, where he designed and supervised the asset management protocols for 35 states from the Brooklyn headquarters. He's a former chapter and president of the National Board member of St. Anthony's Hall, the oldest collegiate literary society in the US, and he was the first African to hold either position since its foundation in 1847. Permit me to also welcome another member of this committee, Mr. Jones Asamoah. He is a healthcare manager with over 15 years experience in the area of the pharmaceutical industry. He has extensive background knowledge and understanding, specializing in management of pharmaceutical care. One of the things that I think you'll find very important about his experience and expertise is his Master's of Business Administration in Healthcare Management from the Paris Graduate School of Management. He is certified on guidelines on bioavailability and bioequivalence studies at the West African Health Organization. He also holds a Master's of Public Health at the University of Ghana. He does have extensive experience and expertise in a number of other areas, including financial management and commercial management from UK distance learning programs. He also has a Bachelor of Pharmacy from the Kwame Nkrumah University of Science and Technology. Ladies and gentlemen, I'm very pleased to also welcome Dr. Zaneto Ajiman-Rawlings. She is the Honorable Member of Parliament for the Clote-Corley constituency. She is a standing committee member for gender, also a member of the Defense and Interior committees, and Deputy Secretary for the Women's Caucus in Parliament. Relevant to this committee's activity, she's a medical doctor and alumni of the Royal College of Surgeons in Ireland, with over 10 years' experience in general practice and family medicine. Prior to becoming an MP, she had a master's in degree conflict, peace and security from the Kofi Annan International Peacekeeping Center. Permit me to also welcome and introduce to you Dr. Vida Yakong. Dr. Yakong is a senior lecturer at UDS Tamale. She is currently the Vice Dean of the School of Allied Health Sciences. She's also the head of Department of Midwifery. She holds a PhD in interdisciplinary studies in medical anthropology with a Master's of Science in Nursing and a Bachelor's of Science in Nursing from the University of British Columbia in Canada. She also has a diploma as a nurse practitioner from UDS Tamale, and she is the CEO of Ghana Rural Opportunities for Women. Distinguished guests, ladies and gentlemen, as we proceed in the coming days and weeks, we will continue to have the opportunity to introduce various other members of the committee. My name is Mawena Treba. I am a former CEO of the Ghana Investment Promotions Center. I am a geologist by profession, and I have the privilege of supporting this committee with communications. Ladies and gentlemen, at this point, I'd like to speak to the objectives for today's media encounter. It is firstly to present the committee's assessment of the statistics and the data as it relates to Ghana's current situation vis-à-vis COVID-19. We believe that there is a need and there is an urgency to the review process in order that we put more urgency behind managing and defeating this pandemic in favor of prevention versus recovery. We also seek to build confidence in our ability as Ghanaians, armed with robust information to fight this disease. We believe that our window of opportunity is closing, again, based on medical data, and that we have and we must highlight these statistics and further other collaborations that we would like to pursue with government to ensure that there is a humane approach to addressing this crisis immediately. Before we begin our proceedings, it's important that we as a committee acknowledge the excellent work of Noguchi Memorial Institute and Kumasi Center for Collaborative Research in Tropical Medicine in collating a lot of the medical data that we have been analyzing and reviewing. I will be inviting to the podium 4 speakers who will raise critical questions and offer recommendations to address those questions around more robust information to the Ghanaian people. Robust information around public health management, robust information in supporting technical requirements to fight COVID-19, robust information that allows us as a committee to recommend more strategic community impact mitigation measures, and finally, information that helps us to be more aggressive in addressing the economic implications of COVID-19. We would invite Ghanaians to be dispassionate and situate our submissions around the epidemiological data to fully appreciate our reality that we are in a race against time. We need to be prepared. We should not panic, and we should not allow fear to rule us, but we must be prepared. The numbers suggest that we are quickly approaching an increase in exposure to the virus in our country. The statistics do not suggest that we are in a position to fix the spread. At this point in time, we really must progress quickly and brace ourselves appropriately to manage and collectively defeat the disease. At this point, it is my privilege and my duty to hand over to our technical experts who will be addressing us today. Let me begin with Mr. Jonas, who will speak to us about public health management. Thank you very much.
Thank you very much, Mawina. The first reports of what would eventually be called COVID-19 emerged in the early days of December 2019. Since that time, the spread of the disease has been very explosive, and evidence suggests that it is accelerating. From its origins, it took approximately 12 weeks for the first 100,000 cases to be recorded. It took 12 days for the second 100,000 cases to also be recorded. And interesting to note, it took just 4 days for the third 100,000 cases to be recorded. This is the nature of the foe we are dealing with. It therefore calls for a ruthless and aggressive way to arrest this pandemic. A robust system-wide response from all stakeholders in public health is a central component of a comprehensive national response plan. Our system, in its present condition, is outstretched and under-resourced to deal with a surge in healthcare needs that would accompany an exceptional increase in cases. We are in a desperate race against the clock to ensure that critical actors in the system are provided with the resource, equipment, and training to stand up to what the days and weeks ahead will bring to our way. And we must be clear in our minds about what this means in practical terms for our healthcare providers and their patients. We must face up to some hard facts about our own situation in Ghana. Comparatively, for the first 8 days of the disease progression in Ghana, being compared to Germany, Italy, and the USA, Ghana has had the highest for the day 8, which is 21 infected cases. According to the Center for Disease Control, CDC, the rates of spread start to increase exponentially from this point. They estimated that one person can actually infect about 10,000 people within 3 weeks in the progression chain. The dashboard trajectory of COVID-19 disease in Ghana that was actually experimented came out to estimate that 28, 543, and 525,325 infected cases are to be expected for days 9, 18, and 36 in that order. So at day 36, an estimated amount of around 553,000 infected cases as per the trajectory is what we are expecting. What this in mind means is we are racing against time. Today marks the 12th day of our own battle with COVID-19. We have gone from 2 imported cases at the outset to 52 as of today, including recorded cases of local transmission. We have now tragically recorded 2 deaths. May their soul rest in perfect peace. Many of our compatriots who who have tested positive have reported contact with others in their communities. But despite great efforts by the Ghana Health Service and the Ministry of Health, many of the nearly 600 of them have not yet been successfully contacted and isolated. Under these circumstances, we are out of time for wishful thinking. The lessons from other nations should guide our thinking about how best to evolve our strategy to contend with the realities of the day. We recognize the efforts of government in actually taking the necessary steps to reduce the risk of recording additional imported cases. The decision to close our borders could not have been an easy one, given the repercussions for trade, travel, and tourism. However, it came rather late. But our land borders span nearly 2,500 kilometers. They are hard to monitor and porous. So we cannot presume the closure of our air and sea ports to be sufficient defense against imported cases. Our neighbors in all directions are struggling with COVID-19 too. At this time, it means we must be realistic about the true effectiveness of border control and its impact. Similarly, we know we have an ongoing local transmission and that there are several high-risk individuals who have not been successfully located as yet. Contact tracing is a race against time. And for every day, our determined public health workers are unable to find and isolate these individuals, the risk of further local infections. This is the reality. This strategy in itself must be accompanied with rigorous and rapid testing. It is essential to have capacity for accurate mass testing, as South Korea's example shows. We understand the current challenges in procuring the necessary test kits, given the high demand for them. However, the evidence is quite clear that 50,000 test kits is simply not enough for a nation of 30 million. The current strategy for testing is structured around a case definition approach, which limits tests to individuals showing symptoms of COVID-19, but it ignores the fact that many infected persons can be asymptomatic carriers. Limiting tests to clinical cases only, rather than mass testing, creates the situation where infected individuals who do not feel sick or show symptoms remain untested, unidentified, and untraced. The inherent risks of limiting testing in that way are great and obvious, especially in social distancing if not properly observed. The solution to this is mass testing, wide availability of test locations, and communication of results. And again, 50,000 test kits simply will not suffice for this purpose. We recommend, given this limitation, for government to focus those kits on those they are tracing on contact basis. But they must be quick, as time is not on our side. Government has now prescribed social distancing, but understandably, the compliance has not been universal. We understand, however, that this measure must be successful given the difficulties we are currently having with mitigation strategies. Failing this, the situation here might soon resemble that of the United Kingdom, because it is imperative that we limit what havoc this virus may wreak on our nation and the economy. These are verifiable facts and not just sayings. And the implication for the viability of our present approach is not partisan. It is public health science. The purpose for this advisory body is to review our current challenges in the battle befalling our nation and to make recommendations to reinforce ourselves for the weeks ahead. We do so not to undermine or usurp government in those respects, but to complement the efforts of government. We understand the instinct to be cynical about our motives. The partisanship and pettiness in our politics has bred this mistrust. But the truth is that we are all in this together. we must act together as one in the interest of the nation. First of all, we need a multi-sectorial approach. How is it done? We need everybody to cooperate. We need opinion leaders, we need chiefs, we need imams, we need NADMO, we need security services, all hands on deck. The COVID-19 disease knows no political, religious, or ethnic affiliation. We need an effective public education and sensitization through the media. Ideally, mass testing with RDTs, or rapid diagnostic testing, should be procured so as to get more people tested and rule out careers. Government should invest in test kits. Early detection is key here. This can be distributed to key health facilities, including CHIP compounds and pharmacies, for easy accessibility. We should provide enough PPEs, or personal protective equipment, for our frontline workers. For our frontline workers, these PPEs include gloves, sanitizers, nose masks, protective gowns. This should be provided for all health workers, both in the government and the private institutions. There should also be proper training and capacity building for all frontline workers and other stakeholders. More isolation centers with the requisite equipment should be in place. If possible, at least there has to be one isolation center in each region to facilitate case management. Existing facilities, including laboratories, should also be upgraded. The TUC and the Noguchi Memorial Center are the latest organizations to actually join the call for a lockdown. Recent events makes it clear that government must begin a more humane lockdown approach. Thank you very much.
Thank you very much. As we continue to proceed with our program, I'd like to, before I invite the next speaker, acknowledge the presence of the Member of Parliament for Ajumako Enyan Esiam constituency in the Central Region. He is also a former Deputy Minister for Finance, and he will be addressing this forum, speaking to the economic implications of COVID-19. It's my privilege to also acknowledge the presence of Honorable Ato Forson, a member of this committee. At this point, permit me to invite Dr. Zaneto Ajiman-Rawlings, who will speak to us about community impact mitigation strategies from the perspective of this committee. Thank you.
Thank you very much. With regards to community impact mitigation strategies, the COVID-19 virus is spread mainly by droplets and aerosol within some contexts. We have gone from imported cases to locally transmitted cases within a matter of days, which indicates a disturbing trend in Ghana. Early detection, contact tracing, and strict quarantine measures have proven effective in other countries. However, we seem to be behind the curve as a nation. Interventions to decrease the rate of transmission are essential to ensure that we do not collapse our healthcare system by exceeding its capacity to cope. Some of these interventions are effective hand washing, social distancing, general testing of the population, and travel bans, some of which have been instituted already. South Korea, for example, employed the use of extensive testing for the virus and social distancing. Singapore employed rapid detection and diagnosis, including GPS data from phones of affected persons, strict enforcement of quarantine, and government transparency. The main preventative measures against the spread of the virus, such as hand washing and social distancing, are very difficult to adhere to given our densely populated communities, our markets, and our public spaces, and the intermittent access to, and in some cases, the lack of access to water. The successful end to this crisis will require the involvement of the government in engaging the citizenry, including civil society and the security apparatus, to support efforts within the community. There must be community ownership in organizing and executing the response interventions in order to break the cycle of transmission and infection through sustained behavior modification at all levels. The markets and transportation network are crucial to maintaining our food supply as a nation. This was the rationale behind the omission of the markets and commercial drivers from the restrictions laid out by the President. Given this fact, not enough has been done to ensure the safety and security of the market traders as well as those who visit them. Their protection should have been top priority in anticipation of and subsequent to the imposition of restrictions. The various assemblies must, as a matter of urgency, provide Veronica buckets, soap, and disinfectant for all markets across the country to reduce the risk of exposure and risk of transmission of the virus. And this must be coupled with a serious education drive by the National Commission for Civic Education and health directorates at the district level. Indeed, if there was ever a time to put the RegSec and DISEC to use, this is it. These must work closely with the communities to identify and report cases in order to test and undertake rapid contact tracing and quarantine measures. The most recently publicized fumigation of the markets highlighted some challenges. 1, the resistance of the traders to the spraying due to insufficient stakeholder engagement and education on the objectives of the exercise. 2, no communication on the duration of effects of fumigation on the markets, and whether this is to be repeated at regular intervals. There is a very real danger here of creating a false sense of security in the markets following the fumigation exercise amongst traders. There's also the concern about the chemicals used and whether they're harmful for human consumption, as most of the foodstuffs were simply covered and left in situ during the exercise. The omission of the transportation sector from the restrictions also, although well placed, have inadvertently left drivers and other passengers at greater risk of exposure to COVID-19, as there was no serious nationwide engagement to target drivers at the district level regarding practical steps that they can take to minimize their exposure and risk of transmission between passengers. Some practical solutions would include ensuring compulsory supervised hand washing for all passengers and regular hand washing for all drivers who attend the lorry stations and transport stations. Regular disinfection of doors, seats, especially before and after passengers have been transported. Possible solutions could be an incentive scheme with enforcement for trotro drivers to decrease the number of passengers they carry in order to satisfy the social distancing requirements laid out. A shift system with the input of the drivers' unions and welfare associations to minimize the number of drivers congregating in any given station at any given time. A very important question to address is the ubiquitous Okada riders and how we help them to avoid becoming the means of transportation of the virus from person to person and area to area, given their inability to trace their passengers. Much as they occupy a niche which is still not legally recognized, a system must be put in place that helps them to trace their passengers. Many homes still do not have indoor flush toilets, and residents still rely on the use of public places of convenience to respond to the call of nature. These places are also a potential area for exposure to the virus, as it can survive on surfaces for extended periods. So regular inspection of these public toilets to ensure that they have running water in place and buckets and soap and water and disinfectant for all persons to have supervised mandatory hand washing before and after the use of the bathrooms, as well as disinfection of the premises on a regular basis. This means that areas that are experiencing water shortages must have water delivered on a daily basis by tankers or other means. As Ghana struggles to address the issue of open defecation, what measures are imposed on people? They're able to make use of public places of convenience. Will the government ensure that in light of the fact that many people will not be earning an income, they will still have access to these public places of convenience if they don't have the means to pay? Perhaps an agreement could be arranged between the operators of public toilets and the government to ensure that the public can use these at no cost, should it come to that. The primary healthcare centers have not been adequately prepared with regards to adequate preventative measures in place and protective gear for the staff, who also have their lives and families to be concerned about. Indeed, if the staff are to perform their duties, they must at this point have all been trained in the use of protective gear and supplied with same. Due to the inadequate dissemination of information regarding the symptoms and signs of the disease in many communities, it is very likely that persons are likely to attend pharmacies and primary healthcare centers in the communities looking for help, which would put these staff at risk and other patients as well. Protective gear for healthcare staff, therefore, is very important to ensure that they are not exposed to the disease, nor do they become a hub for transmission of the disease to other patients. Every healthcare facility must be prepped and at least one area cordoned off in the event of a suspected case of COVID-19 being admitted to their premises. We're witnessing a progressive restriction, and therefore we should have measures in place to ensure that elderly and persons with comorbidities do not fall victim to the disease merely by their attendance at hospitals or clinics for their routine checks. We should consider having outreach teams in the districts to identify such patients and deliver enough medications to them to last 3 months. What measures have been put in place in the event of positive cases in compound houses where social distancing is virtually impossible? And in the light of homeless people living in the urban areas of Ghana, in the event of a lockdown, temporary accommodation must be provided. Physical distancing will have to be enforced in these locations to prevent the spread of the coronavirus. Feeding and the use of toilet facilities will have to be adequately managed. Potential sources of help could be voluntary clubs, the bed manufacturers like Ash Foam, and food manufacturers and bottled water producers as well. For Ghana's crucial essential services like water supply and power, how are the staff being cared for? Are they being tested for COVID-19 and sequestered? Is there a shift system in place to ensure that these essential services remain uninterrupted during this period in the event of staff members becoming infected? Considering that the reserve capacities of the majority of Ghanaians are quite limited, or in some cases non-existent, we should ensure that the National Food Buffer Stock Company is adequately augmented to ensure we don't have a shortage of food. We are currently experiencing a rapidly escalating humanitarian crisis, which will demand that we collaborate and work in synergy to stop this virus and protect our citizens. Thank you.
Thank you very much indeed. Perhaps I can ask our organizers to arrange some wipes for the microphone as we continue to respect all protocols to protect ourselves. Before I invite Honorable Ato Forson, I would like to take the opportunity to acknowledge with thanks the various media houses that are streaming live today this media encounter. Let me start with JoyNews TV, GH1 TV, Class 91.3 FM, Asempa 94.7 FM, Power 97.9 FM, Ahoto 92.3 FM, Accra 100.5 FM, Radio Gold on Facebook, Wezo TV on Facebook and Twitter, and NDC Communications Bureau, both on Facebook as well as Twitter. I want to thank Mr. Asamoah and Dr. Ajiman Rawlings for bringing to our attention the clearly very stark realities about the management of our public health in the wake of this COVID-19 virus and the implications for community impact mitigation strategies. At this point, I'm sure everybody, far and wide, is very interested in understanding the economic implications of COVID-19 on Ghanaians. And I think we are very well versed to invite Honorable Ato Forson to address this forum. Thank you.
Thank you. Good afternoon. Let me also start by saying, to be effective at implementing solutions to any of these measures outlined by my colleagues in a timely manner, and if we are to give ourselves a fighting chance, we will have to act now. The window of opportunity, as we have already said, should be measured in days and certainly not in weeks. But this or any of those or any other proposal will require a rapid deployment of funds, money, to procure the needed equipment and supplies, improve awareness and accelerate our readiness, reinforce the healthcare system, establish a moral sound safety net for the vulnerable against the inevitable shocks. And we must be able to use these funds in response to the evolving situation in the interest of our nation, Ghana, which requires us to also have great flexibility to reassess and reprioritize over the coming weeks and days. We are aware that our government has approached the IMF and the World Bank for an amount close to $1 billion United States dollars. We wish to say that we harbor sincere reservations about the wisdom and of that course under the time pressures we face. We are reliably informed, and the government is indeed aware, that any such facility would not be available to us as a country until the second or the third week of April 2020. That timeline is constrained by the meeting schedules of the board of directors of the respective organizations, the IMF and the World Bank, and the processes involved in the receiving the funds, even under an emergency approval. Our current state of readiness and the exponential growth of the plague we are fighting suggests that we cannot wait that long. It is with this in mind that my colleagues and I wish to propose an alternative strategy that will avail Ghanaians immediately of the needed resources to drastically escalate our readiness and resilience. We humbly appeal to the government to amend the proposed utilization of the 3 billion Eurobond proceeds to make funds available immediately to cater for the COVID-19 related expenses and the possible adverse economic shocks that may occur. The proposed utilization plan for the 2020 Eurobond proceeds, as originally presented to the Finance Committee of Parliament and later to the plenary for approval, indicated that the proceeds were tied to three main expenditure items, namely budget support, 1, 2, restructuring of the energy sector, and 3, liability management. The distribution of the proceeds according to the proposed utilization plan that was submitted by government to Parliament were as follows, at the exchange rate of $5.72 to the cedi. The budget said they are going to support the budget with a budget support of $1 billion United States dollars, one, and two, to restructure the energy sector debt of $1 billion US dollars, and a liability management of $1 billion, making a total of $3 billion, translating to 17.1 billion United States Ghana cedis. We humble appeal to government to amend the proposed plan to address the pressing coronavirus disease 2019 related expenditure and the financing gap that is inevitably awaiting us as a result of this pandemic, to keep Ghanaians safe, to safeguard the Ghanaian economy against its potential macroeconomic shocks and revenue shortfalls, whilst we await the expected IMF and the World Bank loans in the near future. It is our view that the proposed restructure of the energy sector does not constitute a priority at this time in the face of a rapid escalation in the COVID-19 cases in Ghana. Government may have to consider deferring the planned restructuring of the energy sector to make available immediately $1 billion United States dollars, translating to 5.7 billion Ghana cedis, to fight any further spread of the pandemic. In times of emergency, in economics and finance, we have something we call reprogramming of development program. We wish to propose to review non-urgent expenditures in the 2020 budget so that funds will be made immediately available for the fight against the COVID-19 pandemic. Ghana, indeed, has already recorded a total of 52 cases and 2 deaths, unfortunately. This worrying development requires urgent and pragmatic measures to manage and contain the situation. The economic impact of the outbreak is likely to affect almost all sectors of the economy, hence the need for immediate funding to minimize the effect of this outbreak. We hope that government will review this recommendation favorably and act immediately to ensure that precious Ghanaian lives are saved and that there can be rapid restoration of economic activities in the wake of these difficult times. We owe no less to every household and businesses in this country. May the good Lord protect all of us, and may God bless our homeland, Ghana. Thank you. Thank you. Cheers.
Thank you very much indeed, Honorable Ato Forson. Thank you for bringing to our attention the options that are available to us in how we address the economic implications of COVID-19. It is indeed food for thought. I'd like to alert the local media stations that are present that our speakers will be available for interviews in the local language at the close of this program. So please do not hesitate to make your requests. They will make themselves available to speak to you. We will end our speaker submissions today with a presentation from Dr. Grace Ayensu-Dankwa, and she is going to speak to what I believe is a very important topical issue, and that is the robust nature of the information that we will require in order to properly fight COVID-19. Dr. Ayensu-Dankwa, thank you.
Thank you, everyone. Good afternoon, my fellow Ghanaians, ladies and gentlemen of the press. I would at this stage address you in the importance of effective information dissemination to fight against the COVID-19 pandemic. Information dissemination that is accurate and delivered in a timely manner and in a tone that engages the attention of the public is critical to the fight against the pandemic that is on our hands. Experts everywhere tell us that accurate information that is delivered in a timely manner is critical in managing crisis. This is not about fear-mongering or heightened anxiety. Rather, it is about experts in the field and not political actors who provide accurate information to the public to understand what is happening so the public can respond to advice and measures taken by authorities. One of the key preventive measures in combating this disease is contact tracing. Contact tracing can only work better in an environment where the public has full disclosure of the movements of infected persons. The timeliness and accuracy of information put out by government and regulatory agencies is therefore imperative. Conflicting information breeds confusion and mistrust, which increases the vulnerability of the public to fake news and fake cures. Last night at 10 p.m., it took surfing the net and websites to learn that the number of people who have tested positive has risen to 27 and the mortality to 2. May the soul of those who have died rest in perfect peace. We are just learning this morning that the numbers have actually risen to 52. Ladies and gentlemen, a number of questions beg for urgent answers. We need to currently know how many people are on self-quarantine. We need to know how far we have come in securing test kits and supplies. We need to know how many PPEs we have in the country and how far the government has come in procuring more PPEs. Our research shows that some district hospital staffs and local clinical staff have not been trained in what to look for and proper use of personal protective equipment. We therefore call on government to give us accurate information on the number of medical staff who have been trained and at what specific level. We also ask for accurate information on how many more medical staff are left to be trained and what specific training they are currently receiving. As part of the public tracing agencies, we need to know the role of the district metropolitan assemblies. Also, we need to know the role of the NCCE in this fight. We need to know what specific help they have received from government in terms of logistics and resources to help them do better and quicker public education. The role of NADMO as the emergency relief organization and how government is liaising with them and resourcing them and how the assistance is manifested at the local level is also key. This also applies to our security agencies. In terms of our quarantine centers, we need to know how many we have nationwide. Where are these quarantine centers located and what is their capacity? Also, we need information on the kind of personnel we currently have in these quarantine centers and specific resources they have received. Additionally, we need clear information on the number of isolation centers we have nationwide, their location and capacity, what personnel are staffing the centers, and what clinical services do we have available in these facilities. These are a few of the critical pieces of information that government must provide to the nation as part of its effort to manage the present pandemic we have on our hands. It is important that government set up a specific time to provide accurate live updates to the nations like it pertains to other countries such as Italy, South Africa, and several other countries. This team is ever willing and ready to support government in this regard. We call on the media, civil society, and corporate Ghana to collaborate with government to intensify public education on this pandemic. The surest way to win the fight against the novel COVID-19 pandemic is through transparency and aggressive public education that is based on timely and accurate information. We must all help to achieve that. Thank you, and God bless our homeland, Ghana.
Fellow Ghanaians, distinguished guests, members of the media, as we draw a close on our speaker submissions, I think it is abundantly clear that we are in a crisis situation. It is also clear that this technical committee does offer a wealth of expertise that will be available and at the disposal not only of government, but of all Ghanaians. We intend to provide information not just from today's proceedings, but other analysis that we intend to conduct to make available to the Ghanaian public so that informed decisions can be taken to protect ourselves as a nation. Again, as we conclude, it's my privilege to invite our chairman of this technical committee to speak to us and offer some summary remarks for consideration. Honorable Prosper Bani. Thank you.
Thank you very much. I would like to start by re-echoing Dr. Ayensu's words to the media that at this point we need a committed media collaborating with government and other institutions to ensure that there is a transformation process to reflect the reality of reporting in this country as we confront COVID-19. I am saying this because the moment of doing business as usual is gradually slipping away. And this is the time for all of us to consider this pandemic as a crisis. And in this situation, we cannot and will not leave anyone behind. Indeed, government in the several weeks that have passed have made some very sound recommendations and defined certain actions to mitigate the spread of this virus. Today, I can say that this is not enough. This is not enough to flatten the curve of spreading this virus, to save lives, build confidence in our people, and get communities mobilized to support the response. Should we lose the war in our communities, then we have lost the war in the country. What do we think should be done? First of all, the government's technical committee must be elevated into a crisis management team to reflect that it is not longer an ordinary technical coordination committee, but that it's a committee made up of all sectors of the economy to address the crisis that confronts us today. Today, we have the number 52. From all my assessments, the numbers are increasing. Therefore, testing is critical. We cannot postpone it. We cannot redefine it. What we need to do is to act and test our citizens as fast as we can. 50,000 testing kits today is not enough. Without testing, we shall not know who has the virus or not. And it has been tested in real time, in real situations, that the more you test, the more you have control over the spread. Should we test and find people positive, then we need to prepare adequately for isolation of these citizens. Therefore, we need isolation centers. We haven't seen, or I haven't seen, any well-equipped, defined isolation center since this pandemic broke out. Let the leaders demonstrate to us where these isolation centers are, how they are being manned, the equipment they have provided the frontline health workers, and how they expect treatment to take place after that. My colleagues have already attested to the fact that we need an aggressive contact tracing and reporting of suspected cases. We will continue to follow all the contacts that have been traced, how they've been quarantined and being monitored aggressively to the extent that we don't have situations where people are asked to quarantine themselves and they broke loose on the streets. This is not a sign of a disciplined crisis management exercise. We need to get our act together right now and right here. We are also very pleased to know that since our country borders were closed and the aircrafts from any other country have been stopped from coming into our country, the last couple of flights had all their passengers quarantined. And it is out of this testing exercise with these quarantine passengers that we have our numbers elevated from 27 to 52. What about the borders beyond the airports. As we speak today, people are going in and out across these borders. Border officials have complained that they are not very much protected and they do not have the right equipment to process citizens crossing these borders. If that is the case, we need to double up our efforts. Otherwise, whilst we gain from the closure of the airports, we may be opening another door through the unmanned borders of our countries. Should people be tested and found positive in this type of exercise, we need to ensure that our citizens are taken care of and taken care of properly by ensuring that the hospitals are well equipped, build the confidence of our health workers by providing the appropriate PPEs, without which they may be worried and scared to treat our citizens. I have no doubt that our front-line health workers are ready to support our citizens recover. But if they are not well protected, and as we know, the experience in other jurisdictions suggests that if our frontline workers are not well protected, they may as well be affected. That is the reality. So we need to engage them, provide them their support to ensure that we get the kind of support needed from them. In this kind of response and in the environment we find ourselves, we need to bring everybody together. As we sit here, whilst we have all the information, I do not think that the urgency that is required for us to respond to the appropriate measures has reached the point that is desirable. If you are in a crisis situation, you will feel it on the streets. You will feel it in our communities. You will feel it with the pronouncements made by public officers. You will feel it in the institutions we work in. As we speak today, individuals are taking their own precautionary measures. I know some institutions that are coming out with their own arrangements to ensure that there's distance, there's social distancing, there's physical distancing, as well as ensuring the protection of their workers. If we do not have leadership in this crisis management, individuals and institutions and other organizations will be initiating their own protective arrangements under those situations. And within a crisis response situation, you begin to introduce chaos. Do we want to go there? Not at all. So we need to up our game and to ensure that together we win this war. Indeed, we cannot progress and win this war without resources. That situation cannot be negotiated anymore, and we cannot postpone the action. We need help. As we speak, and from all that my colleagues have said, if that suggests in any shape or form that we are at a moment of a lockdown, let it be considered. The data suggests that there is a need to take a strategic decision with speed. around what looks like today as a crisis that is deepening. And like other countries have done, we need to do the right thing. As President Mahama said, when the situation becomes very clear and all the indications points to a certain direction, the right decision on lockdown will be made. We will also want to suggest that the committee, the NDC Technical Committee, is developing a comprehensive plan on the fight against the virus. However, in the interim, we will be presenting a document to government on our current assessment and alternate solutions today. Today, because we cannot wait for tomorrow. The situation is urgent, which requires urgent crisis management and response. Thank you very much. How to do this first. Okay. This is also very new.
Thank you very much indeed, Mr. Chairman. At this point, I'd like to invite all of our speakers to join me on the podium because we will take a few minutes to field some questions from our media partners this afternoon. But let me request that we respect physical distance. And perhaps, if at all possible, if there are questions that the media have directed to a particular speaker, we will pass on the microphone and invite them to speak. Let me conclude today's proceedings before we get into our Q&As by pointing out again that our ultimate goal as a technical committee is not, and I repeat again, is not to create fear. It is to ensure that every single Ghanaian, no exception, is prepared for what is ahead of us. And I'd ask that we continue to keep that in mind. At this point, let me invite our colleagues from the media, if you have specific questions that you would like to have a response to, we are ready and available for that. If you'd be kind enough to just quickly mention your name and your media house. Thank you.